morning, Kristine. Thank you for joining us again because of the webinar that we held last week. We'd had problems with the platform. And so we are recording it now for the people who are interested. I'd like to quickly acknowledge the country where I am in WA is a Noongar country. You're obviously in Tasmania, and for all the people coming in to watch this recording, Dr. Kristine Barnden is an obstetrician in Tasmania, special interest in teaching ultrasound and also Doctors for the Environment Australia. Kristine, thank you so much for giving us your presentation, and good luck.
Thank you, Crystal. Hello, everyone. Thank you very much for inviting me to talk. I was really pleased to be able to do this. I just wanted to introduce myself very briefly. I'm an obstetrician in Hobart. I'm in Muanina country currently. And what led me here was probably about 5 years ago. I realised whenever there was something about climate change in the media, I either turned the page or changed the channel. And this was because it was scary and overwhelming and I felt helpless. I decided that wasn't a very mature way to deal with a problem, so I made myself pay attention. And it was scary and overwhelming, and the only way I could deal with it was to not feel helpless. And that's why I joined Doctors for the Environment. And initially it seemed that advocating on behalf of climate and the environment was something I did outside of my work, but honestly, there are so many parallels between human health and the environment that I now feel, and I hope you will too by the end of the presentation, that this is an intrinsic part of what I do as an obstetrician. So just a bit of summary of what we're going to be talking about today. I'll start with a few background concepts and go from the very small to the extremely big. Most of the talk is going to be focusing on the effects of heat and air pollution on women's and maternal health, and the sort of co-effects of stress and socioeconomic inequality are wound in throughout, really. I'll also talk briefly about disaster and its aftermath, and then move on to some solutions and strategies. And these are either things that you can talk about with your patients at individual level, or there'll hopefully be some ideas there for advocacy as well. So starting with the extremely small, with our DNA, which by a process known as epigenetics, genes are being switched on and off continuously in response to environmental cues. And that's happening in the gametes in the months before conception. So the genes that get handed on to the embryo reflect the maternal environment and paternal environment prior to conception, and the process then continues in the embryo. So the first concept is really that there are changes taking place in a growing embryo that are going to have effects right through the lifespan. So the best studied environmental stimulants are diet, stress and pollution, and either by direct effects on the placenta or by transplacental messaging, they can then result in, and once again, well studied, and most of what we're going to be talking about, sort of measurable impacts of growth restriction, preterm birth or stillbirth. But there's a lot just going on in the background. And so even in those pregnancies that don't end in growth restriction or preterm birth, and also as a linked to those as well, there's a growing list of chronic diseases, both behavioural and physical and psychological, that have been shown to be affected by fetal programming. So we need to keep that in the back of our heads as we go along. Moving out a little bit, most of us are working at the level of the individual woman and family. And what you'll see is that for the average woman with average levels of exposure, you can tell her that although there are effects of heat and air pollution on pregnancy, in the most part, they're actually very small, and there are measures that she can take to avoid or modify effects. However, a very small effect in the individual woman, because of the pervasiveness of air pollution and heat and stress, that can translate into a very significant public health burden. Also, the other concept that I wanted to talk about on this slide is that the studies that have been done on exposure to heat and air pollution aren't necessarily looking at populations, average people, average levels of exposure, and controlling for other potentially modifying or other factors such as stress. But not every woman is an average woman with average levels of exposure, and many will have significant modifying effects. And so some will be at much higher risk than the studies might suggest. Moving out to the big picture, looking globally, environmental causes are thought to be linked to about 24% of premature morbidity. And it's actually really shocking. I was shocked that 91% of the world's population is living in places where air quality standards are poor. And obviously, once again, the risk of morbidity or mortality from environmental exposures is highly influenced by poverty and inequality. Also on this slide, notice that although climate change is there as one of the environmental causes of morbidity and mortality, things like air pollution, inadequate water, agricultural practices, built environments, very much link in with climate change. So women are highly vulnerable to the effects of climate change, mostly because of inequality. So of the 26 million people so far estimated to have been displaced by climate change, 20 million are women. Of the world's extreme poor, the majority are women. Women in poor countries are disproportionately engaged in subsistence farming and water collecting, and thus often more exposed to environmental degradation. There are gender differences in deaths from natural disasters, and these seem to be directly linked to women's economic and social rights. And I'll talk a little bit more about that later. Also, women are less likely to be in decision-making roles. So somebody asks you to give a talk about climate change and health, and you go, oh, that's easy. Climate change, that causes heat, that results in unstable weather patterns, and that results in health impacts. But we need to consider that there are also other environmental factors happening at the same time, some of which will feed into the health impacts of climate change, and others have environment health impacts all of their very own. And one example of that might be plastic pollution, plastic being almost ubiquitous now in the air and the water, and the endocrine disrupting effects of that. Also, at the same time as we're talking about climate change, we're talking about the causes of climate change. And the ones that particularly came out in preparing this talk: industrial agriculture and our food systems, fossil fuels, urban design. And these, independent of climate change, have health effects. But we also see that the health effects of climate change, or the effects of climate change, feed into those and exacerbate those. So heat increases air pollution, food insecurity causes further deterioration in diets. And then finally, we need to talk about the causes of the causes, the reasons why, despite we know how harmful these things are, and despite having, in many cases, viable alternatives, we're not changing quickly enough. So things like societal structure, belief, values, attitudes, history, as well as causing the causes of climate change, they also feed into the social determinants of health. These, once again, independent of climate change, have effects on health, but they also increase levels of exposure to the health impacts of climate change. And once again, all of it leading to poor health through the lifespan. Moving out further to look at the whole globe, you can't really even see the atmosphere in that picture. It is such a thin, thin shell. And yet into that, we're exploding the equivalent of 500,000 first-generation atomic bombs in energy and pollutants. And moving right out, it's the only one we've got. We're using the Earth like it's some consumer item that you can just use up and replace with another one, but that's just not the case at all. So back to a relatable scale. This is a clinical scenario. So Jess is a 26-year-old woman. She's got one other child, uncomplicated pregnancy. She's slim, she's a non-smoker, and she's at 24 weeks gestation. And she tells you that she's living in a caravan at the back of her parents' house because of housing insecurity with her partner and 8-year-old daughter. The area that they're living in is currently affected by nearby bushfires. It's summer, and she tells you she's worried about the effects of heat, smoke, and stress on her pregnancy. So what can you tell her? What should you tell her? Can you help her? We'll start with heat and thinking about the ways that humans adjust to a heat stress. So there are physiological changes that predominantly increase sweating and cutaneous vasodilation. And to accompany those, we need to drink more and to increase the volume load in our circulatory systems. Now, it seems that women, in comparison to men, do this less efficiently, but pregnant women even more so. So you think about the physiological changes of pregnancy, and that's, well, cutaneous vasodilation and increased volume load. So when it comes to adjusting to heat stress, pregnant women have already done what they can and they've got less room to move. And I won't go into it, but I've just given a list of the ways that we think heat may impact on pregnancy. Socioeconomic and cultural factors are also important. Some women are limited in the way that they can initiate behavioural changes. Preparing for this talk, one of the really confronting articles I read was looking at increased death rate amongst women in rural India compared to men. And although they did identify a number of factors, the one that really struck me was inadequate sanitation. So with no private way to go to the toilet, women in some areas are in the habit of getting up before sunrise so that they can go to the toilet in the dark. And then they basically restrict their fluids all day so that they can hold on until after sunset. And in heat waves, trapped indoors with sort of uninsulated, uncooled buildings, that leads to an increased death rate. So looking at heat and pregnancy, it's actually really hard to compare studies because of different definitions of heat and different outcomes. They're really heterogeneous, but what we're consistently seeing is increased risks of preterm birth, low birth weight, stillbirth, NICU admissions and infant death, also congenital heart defects, and an increased risk of miscarriage. So in the main, there doesn't seem to be any one critical exposure window. The effects can be immediate, they can be delayed, or, through a long hot summer, they can be cumulative. Acclimatization is really important. So average local temperatures. So at a 28-degree day, we'll be really feeling that in Tasmania, whilst you guys in Western Australia are sort of wondering whether or not to take your cardigan off yet. Seasonal timing is also important. So a heat wave right at the beginning of the summer is more likely to cause problems than a heat wave towards the end of summer. And once again, effects can be exacerbated by things like air pollution and socioeconomic factors. So I'll just run through a few studies just to give you a flavour. So this US study looked at different definitions of heat wave, but even with the most conservative definition, they found that the average risk of preterm birth was 13% higher amongst mothers who experienced a heat wave during the last week of gestation. So if you're in a community where your risk of preterm birth is about 7%, that's pretty average, that 13% increase risk will take you closer to 8%. So for the individual woman, not a huge increase in risk, but then when you look at it across a population, once again, a US study, they found that 5% more children were born on unpredictably hot days than would be expected, and that in total, hot weather causes about 25,000 babies each year to be born earlier than they would be otherwise. And for those 25,000 babies, the average loss was about 6 days, but some losses were potentially as large as 2 weeks, which is actually really, really important when you look at those downstream chronic long-term effects of early birth. Stillbirth, this was an American study, so it was a 10% change in the risk of stillbirth for every 10% degree Fahrenheit increase in temperature. That's 5.6 degrees in centigrade. And they showed once again a change with maternal race or ethnicity and younger mothers, less educated mothers. So once again, that's that socioeconomic aspect feeding in. a really interesting Australian study that looked at windows of exposure. The one thing that they really did see in terms of at-risk windows was that the first trimester was particularly a risk factor for later stillbirth, and presumably we're seeing effects on placental development. So what advice? I mean, gosh, your mother or your grandmother could sort of give this advice. Obviously, to avoid long periods of exposure to extreme heat, avoiding strenuous activity in the hottest part of the day, loose-fitting clothes, and staying well hydrated. So this woman came up on the internet when I Googled heat and pregnancy. She had the good sense to be born in a leafy suburb in a Western country, but she needs a hat, she needs a shirt, and for goodness sake, she needs a reusable drink bottle. Okay, so moving on to air pollution. Sources are, some are well known, we've known about them for ages, so transport, power generation, things like bushfires and dust storms from drought are becoming increasingly into the public consciousness, but also indoor air pollution, and that's in both developing countries and developed countries. I'll talk a little bit about that. It's actually quite surprising and alarming, the effect of indoor air pollution. So there are a lot of constituents that can be in polluted air. Particulate matter seems to be the main problem for health, although the others certainly are not benign. And that's divided into PM10, 2.5 or ultrafine particles depending on size. PM10 is the stuff that you can see, it's the haze, it's what makes your eyes itch, it's what makes you cough. The PM2.5 particles, they get down into the alveoli and can cause systemic inflammation and also can potentially enter the circulatory system. And then there are the ultrafine particles that can get right through, and of particular interest to us, can get right through the placenta and into the baby. Particulate matter can be all sorts of things. I used to believe when I sat around the campfire that was sort of natural smoke and that was fine, but it's been shown that bushfire smoke is at least as nasty as urban air pollution. And the one thing just to mention, polycyclic aromatic hydrocarbons, they're caused by incomplete combustion of organic matter. They're not technically particulate matter, but they hitch a ride on the particulate matter, and they can be particularly problematic when it comes to health. So I think you've had another talk on general health effects of air pollution. So just to say that there does seem, like with heat, that women have an increased susceptibility to environmental toxins in the air, and pregnant women even more so. So with the 40% increase in minute ventilation, you're just basically breathing in more, and women have been shown to have increased blood concentrations of pollutants. Changes in cardiac output, immune function, and insulin resistance can increase the vulnerability of pregnant women to those effects, and particularly cardiorespiratory stresses. So air pollution exposure consistently linked to, not in every study, but consistently, preterm birth, growth restriction, gestational hypertension, gestational diabetes, stillbirth, infertility and miscarriage, and also then in children, respiratory, neurological, cardiovascular morbidity, and obesity. So mechanisms of action, the pollutants can directly affect the placenta, but even when they just lodge in the alveoli and cause systemic inflammation in the mother, that then has downstream effects on the placenta. And transplacental passage has been shown, so black carbon, and that's actually that little picture up there, that the white dot is black carbon, has been found on the fetal side of the placenta. Polycyclic aromatic hydrocarbons have been found in the cord blood of neonates and correlated with neurocognitive changes. And animal studies have shown ultrafine particles to accumulate in various fetal organs, and once again to correlate with changes in behaviour, metabolic function, structural changes, and other bad things. So going through a few studies, there was a meta-analysis of air pollution and preterm birth, which showed a 1.24 increase in the risk of odds ratio of preterm birth for every 10 micrograms per metre cubed increase in PM2.5. take that from the individual to the population level, it's been estimated that worldwide there are about 2.7 million preterm births, so that's less than 37 weeks, every year, or about 18% of total preterm births. And about half of these were found to be due to indoor air pollution. So just to put those levels in an Australian context, the annual average PM2.5 levels in Sydney and Newcastle are around 10 micrograms per metre cubed, but during the bushfires early in summer of 2019 to 20, the average over those 3 months was 26, but on other days it got up much, much higher than that. Roadside measurements of PM2.5 in rush hour have been shown to be up to 280 micrograms per metre cubed, and that's more than 10 times what the nearest monitoring station was reflecting. So think of someone who's living on this busy, congested street or working in a cafe, their levels of exposure are going to be much, much higher than what you would think from what the monitoring station suggests. Very famous natural experiment when the air in Beijing was cleaned up ahead of the Olympics in 2008. And those pictures are actually both taken during the Olympics, so that was just to show that they weren't as successful the whole time as they would have liked to have been. That was showing that there was an average decrease, there was an average 23 grams increase in birth weight in babies born whose mothers were pregnant over the Olympics compared to the year before or the year after. Once again, 23 grams doesn't seem like a lot on an individual level, population level. This was a paper that was just a report that was just published by Greenpeace, and they estimated that Australia-wide, there's about 845 babies born with low birth weight, just due to coal-fired power generation. So that's not including transport, not including bushfires. Low birth weight, that was defined as a birth weight of 2,500 grams or less. So that will be some babies that are born preterm, others that are growth restricted. It sort of captures all of those. Everyone's interested in bushfire smoke in pregnancy. So far, the biggest study was done in Colorado, where they looked at several years. That included over 535,000 pregnancies, and they looked at birth registry data and PM2.5 levels in sort of the areas where mothers lived. They showed that first trimester exposure was linked to decreases in birth weight, increased risk of gestational diabetes, and an increased risk of gestational hypertension, whereas preterm birth particularly showed up with second trimester exposure, but as also did GDM and gestational hypertension. In Australia, we're going to be increasingly exposed to bushfire smoke. This is from the Climate Council website and just shows how the days of high and extreme fire danger have already increased and are predicted to increase further. The main Australian study that's been done so far looking at smoke exposure looked at the Hazelwood coal mine fire in 2014. A much smaller number of pregnancies than the Colorado study, so much less power to find changes, and the only significant change they found was an increased risk of gestational diabetes. In the follow-up study, they saw that children who were exposed in utero were more likely to be diagnosed with respiratory tract infections in childhood. So just briefly, neurocognitive early life exposure. Most of this work is from either animal studies or really, really polluted urban areas. There's a review article there. But just to mention that the fetal brain, I don't know if you can see that really tiny box down the bottom, most organs are pretty much fully formed in the first trimester, but the brain is different. Even between 22 weeks and term, it changes enormously. And so it's really, really vulnerable to toxic insults. So studies have shown decreases in IQ, they've shown structural brain changes, behavioural disorders, autism for kids that have been exposed in utero to air pollution. To give you an idea of the extent, there were studies in Poland and New York looking at IQ, and they showed about a 5-point IQ difference between the children who are most exposed versus those that were least exposed to air pollution. Indoor air pollution, it is relevant to climate change. Globally, it's responsible for an enormous amount of premature mortality and morbidity, but also the particles and the gases that are emitted by the indoor stoves are themselves powerful climate change pollutants. In Australia, it's a little bit of a different story. We've got good stoves. But Australians spend about 90% of their time indoors already, and with heat and air pollution increasing, we're going to be spending more time indoors. So it's actually really important to be aware that this is a big problem. So it's actually thought that indoor air pollution in developed countries causes more morbidity than outdoor air pollution does. And the one study that really stood out was a long-term study following cleaners, and they found that exposure just to general cleaning products that we all have in our homes caused a decline in lung function over time, equivalent to smoking about 20 cigarettes a day. So what can you advise people? Obviously, we advise people to stay inside. This study was an Australian study that looked at how effective that sort of advice was. Depending on your house, how well sealed it is, that provides a 12 to 76% protection from outdoor air pollutants. But they also found that about 50% of houses had significant indoor air pollution. And they also found it was really important to remind people to open the doors and windows as soon as a smoke plume passed, or the indoor air quality would suddenly be worse than the outdoor air quality. So reducing indoor air pollution, air purifiers, partially effective, indoor plants, great. Masks are actually not effective unless you have those really, really high-tech respirator masks, and in fact may be counterproductive by giving people a false sense of security. Really simple thing to do is to avoid busy roads and rush hour traffic. So tell people that if they're walking the kids to school, just even 1 or 2 streets back from the main road can make a huge difference to air quality. And then there are also air pollution warning systems, so apps that you can get such as Aerator and Plume that people can be advised to get. Socioeconomic disadvantage, I keep referring to it. So it tends to increase the levels of exposure to air pollution and heat, but also other things that are linked to socioeconomic advantage, so stress, poor diets, smoking. They have the same effect on placentas, so excess oxidative stress and inflammation that we think is the main mode of action of air pollution. And it's probable that the effects are synergistic rather than additive. So back to Jess living in the caravan. What can you tell her? What should you tell her? And can you help her? I briefly looked for what patient information might be out there, and there's really not a lot. There's a really good article that was published in The Conversation in Australia during the bushfires last summer. Probably doesn't have a really wide readership. And there was also a very good, this is from the American Pregnancy Association website, but there's not a lot. And it is difficult, particularly when you're talking to people who don't necessarily have a lot of agency to make change. And I think we always worry that by telling people about, hey, you know, this could affect your pregnancy, we're causing even more stress and we're actually being counterproductive. And that's certainly the issue that I had with Jess. So Jess is a real patient. I've only changed the name. The circumstances were otherwise identical to what she told me when she saw me at 24 weeks. And I just didn't know what to tell her or how I could help her. I empathised, yay. So she then came in at 26 weeks, 2 weeks after I'd seen her in the clinic, and delivered a small, severely preterm baby, which subsequently died. So I guess I'd like to dedicate this talk to Jess and her baby and hope that I can somehow do better next time. So moving on to disaster, once again taking the global perspective, all up women and children are 14 times more likely than men to die during a disaster. And the overall likelihood is going to be linked to both the levels of gender inequality in a given place, as well as the degree of impact of the disaster. And there are a number of reasons why. Boys are often given preferential treatment, either in rescue or in resource or food allocation after the disaster. Women are less physically strong, may not have learned to swim. They're more likely to be already suffering from malnutrition. They may have less access to warning systems, either because they're indoors or they might be more likely to be illiterate. As well as saving themselves, they're also more likely to be looking out for other vulnerable family members. And they're actually also less likely to use shelters after a disaster. And that might be due to gender norms, so not wanting to be exposed to strange men, or for a very well-founded fear of sexual violence. And extremes and disasters are becoming more frequent. So this is from the insurance industry, just showing how events that might be attributed to environmental devastation or climate change have pretty much tripled, almost quadrupled since 1980. And that doesn't include conflict, which is another effect that we might have from climate change. So the UN has estimated that over half of under 5 deaths, around half of neonatal deaths, and 3 in 5 preventable maternal deaths occur in the settings of conflict, displacement, and disasters. After the disaster, women are more vulnerable to things like infectious disease and poor nutrition, poor psychosocial health. Once again, they have that increased burden of care. Sexual and gendered violence increases, as does human trafficking. And then there's the loss of access to reproductive health care. So the help with, the availability of a cesarean section for that difficult delivery may no longer be there. And a quote from the UN Special Representative for the Secretary General of Disaster Risk Reduction: "It is a plain and simple truth that disasters reinforce, perpetuate, and increase gender equality, making bad situations worse for women." We have inequality in Australia too. This report on gender and disaster, published in 2014, once again showed that women are more likely to be living in risk-prone localities or with inadequate housing, have fewer resources to escape or adapt, more likely to have responsibility for dependents. An increase in incidents of domestic violence has been shown, for instance, in a study that was done after the Black Saturday bushfires. Also, disaster recovery tends to focus more on rebuilding infrastructure than rebuilding community, more likely to result in paid work for men. Is anyone thinking COVID here? Also, once again, caring responsibilities may prevent return to work, and women have a lower savings base. All right, so let's move along to talk about solutions, which sort of come under 2 broad categories of either minimising exposure to environmental hazards or modifying the adverse effects of exposure. So modifiers of fetal programming, these are really, really powerful. And these are what I tend to talk about with my patients who are worried about the effects of stress and heat, growth restriction. Breastfeeding, playing in nature, mental and physical stimulation like reading aloud, and having a healthy diet have an enormous positive effect on the chronic diseases that are programmed by fetal and early life exposures. And that can apply at individual and community level. So both by educating, but also enabling people to access these things. With respect to neurocognitive things, we need to have screening and we need to have early intervention. And once again, fund that makes a huge difference. Trees and green space come out as the real heroes. And once again, they can modify the effects of adverse fetal programming, both for pregnant women and for children after they're born. So yeah, look, this list of solutions it's not comprehensive. It's just the things that really came out for me when I was making this talk. So housing and urban planning. Urban heat islands can have up to a 4-degree centigrade increase in air temperature, or even up to 80 degrees centigrade surface temperature changes. And these are both the new suburbs that are going out, on the outskirts of cities, but also inner city areas tend to be the main areas of urban heat islands. Houses badly built can be poorly ventilated and insulated. People rely on air conditioning, which both adds more greenhouse gases and also which often people can't afford. Lack of infrastructure and public transport. People rely on private transport. Once again, more greenhouse gases, but they may not afford it. And then there's social isolation, more stress. And once again, these areas are highly correlated with socioeconomic status. So this is a map, a thermal map of the western suburbs of Adelaide, where I grew up. On the left, that's air temperature up to 4 degrees centigrade higher. And on the right, it actually shows areas where you're getting up towards 80 degrees centigrade surface temperature compared to leafier, I think that's a golf course, leafier areas where you might be around 20 degrees on the same day. And then you can superimpose on that a map of socioeconomic disadvantage, and you can see how well those heat islands and socioeconomic disadvantage correlate. And the shame of it is we know how to do it better. We know how to make cities sustainable and livable. And I think allowing suburbs like that I showed before to go up when we know how bad it is, I don't know, is it too extreme to say that's a crime against humanity? So look, getting well out of my comfort zone in the area of expertise, but regulation and policy are really important. I won't go into this anymore other than to say that Australia has worse standards for emissions from transports, fuel efficiency, and for coal-fired power stations than most developed countries and many developing countries, and there is so much room to do better. Population, have to talk about population. So it sort of makes sense that the more people there are in the world, the more strain there is on resources and the more greenhouse gases there are emitted. But population is really fraught and complex. For a start, no one wants to be told how many children they should have. Efforts to control population often can be, or can just be perceived to be, a front for racist or classist agendas. And I think also population is often used as an excuse for not taking other forms of action. There's also the consideration that the areas that have the highest population growth tend to be those with the lowest emissions. And also that certainly in the developing countries, as population decreases, that often tends to be correlated with an increase in household income and then more consumption and a higher carbon and environmental footprint. So we need to approach, we need to talk about population, but we need to approach it obliquely. So how do we reduce population? We educate women, we provide contraceptives, and we increase the status of women within a society. And this is just stuff we should be doing anyway. And the fact that it decreases population and thus hopefully decreases environmental effects should just be seen as a really, really, really nice side effect. And I just wanted to draw people's attention to the graph on the right, where in the y-axis, percentage by which women's status approaches that of men in country populations, it just ends at 85%. Also, we need to talk about other benefits of family planning. So where women are able to limit their families, and it's estimated that up to about 217 million worldwide cannot limit their families, even if they would like to, that's estimated to reduce, that would be able to reduce maternal deaths by about a quarter. Also improves women's autonomy and their earning power and overall family health. And it's been estimated that every dollar you put into sexual and reproductive health, you get returns of about $120. And this just should be such an absolute priority, and any effect on greenhouse gases downstream, oh well, great, but that's not why we're doing it. From the Australian perspective, this graph shows you how in developed countries, having one fewer child is by far and away the most effective thing you can do to reduce your personal carbon footprint. I'm not suggesting that we go out and tell people to have less children for the environment. What I am saying, though, is that around about 25% of pregnancies in Australia are unintended, and the most effective things we as doctors can do is to make sure that women who aren't planning pregnancies have safe and reliable contraception. So the Drawdown Project was, or is, a collaboration of scientists and other people who are basically looking at the ways we can either reduce carbon dioxide emissions or draw carbon dioxide out of the atmosphere, and they're ranking those things in terms of efficacy. So I saw Paul Hawken, who's the coordinator of the project, speak, and he was saying how when they'd finally crunched the numbers, he was heartbroken to see refrigeration coming up top, because it just not that sexy or media friendly. But what he then saw is that if you take educating girls and family planning, and it's not just through population that this has an effect, but also women tend to be more environmentally conscious and tend to bring other things to societies if they're participating fully. If you put educating girls and family planning together and call it empowering women, that then becomes the most effective carbon mitigation strategy. So I'm going to conclude on that note with a quote from one of my heroes, Mary Robinson, ex-President of Ireland and UN High Commissioner for Human Rights, that climate change is a man-made problem with a feminist solution. Thank you.
Well, thank you very much for that, Kristine. I think that's a very powerful finish, and it sounds to me like that's a whole topic of its own, that maybe needs some more exploring. I I'm so grateful we got to do this. I was going to come up with questions, but they're like a little bit sort of detailed. And I think as a wider scheme of things, it's good to let that sink in, all the things that you've just covered. Do you want to expand a little bit on the Al Gore leadership program or something that you did recently? Is this something that you'd recommend?
Yes, actually, that was so that's the Climate Reality Project, which is founded by Al Gore, and it's a worldwide thing where basically there's a fair bit to it, but the crux of it is you get Al Gore's slide deck. So he has a lot of slides and a lot of background information that enables people to customize it to their selves and their community, and go out and give presentations about climate change. And it has been, prior to this year, been run at country level. So I think last year there was a training session in New Zealand, in Brisbane over a weekend. Post-COVID, it's gone online, which was actually fantastic because we got to network with people from all over the world. It was free. It was easily done. It was in the space of a week. There are a few evenings, few things that you could just do in your own time. And yeah, look, I highly recommend anyone joining any subsequent. I think they do it maybe 2 or 3 times a year.
Thank you so very much. I think one of the things that stood out for me, it's not a question, but a comment, is that I didn't really realize to look at indoor air pollution, because often when we talk about air pollution, I think we all have these pictures coming up in our brain about the fossil fuel industry and transport and plane, the sort of pictures. But it's actually helpful to realize that inside your house, what you do matters. Now, you said wearing a mask inside the house is not going to be effective at all, but you said plants might be. What's the scale of, like, how many plants should people buy? Like, what can they do?
I don't actually know the answer to that one, I'm afraid. But yeah, look, the indoor air pollution, I have never actually discussed that with a patient. Partly because I didn't really know until I was preparing this talk what a big problem it is, but also because how do you go telling people their homes are toxic? But I think it's probably possible to select out a few things that you could carefully talk about, and particularly when people are coming and asking you about outdoor air pollution. I mean, obviously smoking is the main thing that is avoidable, and you feel quite good about reinforcing. But yeah, look, it's really, really hard. It's just everything. There's so much that is there and you can't get rid of.
True, and I think it's going to also impact on our talk that we will have next week when we're looking at pediatric health and development through birth to adults, because obviously young people are not the ones making choices, and that's the same for the unborn child, being so dependent on the environmental factors of the pregnant mother. Anything else that you feel we need to add while we're doing a bit of Q&A, Kristine?
Not off the top of my
No.
head.
So if people watch the recording and they have questions, we might kindly come back to you. We have an interactive page where we can then post questions and your answers, and people can go back there and get some interactive information exchange there.
Yep.
And I'd like to thank you so very much for doing this on a Monday in your holidays, and thank you so much for opening our eyes to some of these issues that we have not been told. So I think that's very worthwhile, and hopefully we'll run into you again one day in some other capacity. It is much appreciated. Thank you so much.
It was a pleasure. Thank you.